Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NR443, Week 2. Direct Care Project Part 1. Assessment and Diagnosis. Description. Purpose. The purpose of this direct care project is for learners to apply the nursing process to a community health problem, determined by their observations and data collected of vulnerable populations in their community. This is Part 1 of 4 in the Direct Care Project. Direct Care Project Overview. 1. There are 4 parts to the Direct Care Project. 2. There will be graded project check-ins that correlate to each part. 3. The topic selected in Part 1 will be the same one used in Parts 2 through 4. Your choice is either air quality or substance use. 4. Review the table below for overview and due dates with each topic. 5. Carefully review the instructions, tutorials, templates, and rubrics for each of the 4 parts as you begin this direct care project. 6. Contact your instructor with questions. Overview points. Due date. Projects. Air quality. Substance use. Part 1. Assessment. Check-in 10 Wednesday of Week 2 required. Graded check-in on progress of assessing your community. Part 1. Assessment and Diagnosis 170 Sunday end of Week 2. Assess your community and collect data on air quality. Assess your community and collect data on substance use. Part 2. Planning. Check-in 10 Wednesday of Week 4 required. Graded check-in on progress of assessing your community. Part 2. Planning the presentation 150 Sunday end of Week 4. Create a PowerPoint presentation on the use of the Air Quality Flag Program. You will present to at least 1 organization leader. Create a presentation on the use of screening, brief intervention, and referral to treatment, SBIRT. You will present to at least 3 practicing RNs. Part 3. Implementing the presentation required. Scheduled presentation Saturday of Week 5 through Saturday Week 6. Present to a local organization that serves the identified vulnerable population and could implement the Air Quality Flag Program. There should be at least 1 organizational leader present. Includes participants completing a pre- and post-survey. Present to at least 3 practicing RNs that serve the identified vulnerable population and could implement SBIRT. Includes participants completing a pre- and post-survey. Part 3. Implementation. Check-in 10 Wednesday of Week 5 required. Graded check-in on progress of implementing your presentation. Part 4. Evaluation. Check-in 10 Wednesday of Week 6 required. Graded check-in on progress of evaluation of your presentation and project. Part 4. Evaluating the project 140 Sunday end of Week 6. Evaluate learning and reflect on project. Evaluate learning and reflect on project. Course outcomes. This direct care project enables the student to meet the following course outcomes. CO2 assess the health of populations, aggregates, and communities. PO4. CO3 applied the nursing process to vulnerable populations with professional clinical judgment and evidence-based practice. PO4 and 8. CO5 utilize a collaborative approach to address factors that influence population health. PO2. CO6 examine collaborative trends in community health nursing. PO2. Part 1 enables the student to meet the following course outcomes. CO2 assess the health of populations, aggregates, and communities. PO4. CO3 applied the nursing process to vulnerable populations with professional clinical judgment and evidence-based practice. PO4 and 8. Due date for Part 1. Sunday 11:59 p.m. Montana end of Week 2. Points possible for Part 1. 170 points. Late assignment policy. If the assignment is not submitted by due date, a late deduction will be applied. See rubric below. Directions for Part 1. 1. Review the direct care project overview above. Select topic, air quality or substance use, from the table. This will be the topic of your entire course project. 2. View the Direct Care Project Part 1 tutorial, links to an external site. 3. Download the corresponding assessment and diagnosis template under templates below. For example, if you have selected air quality as your topic, download the air quality assessment and diagnosis template. 4. Collect the data outlined in the template. There are 2 parts. The online data collection. Gather data from the web links provided on the template. The modified windshield survey data collection. Gather local community data by physically looking at your community. If possible, plan on asking someone to drive during your survey so that you can take notes. The community should be the area where you live or the area surrounding your work. The community must include a residential area and be a large enough area to answer the survey questions. If you live in a large area, you may choose a suburb. Note: it is helpful to conduct this portion of the assessment at least 2 different times. During the day or evening, on a weekday, and/or on a weekend. 5. Identify a nursing problem, nursing diagnosis, based on data and observations. You must select a problem caused by your topic. Important: the problem you identify will be utilized in parts 2, 3, and 4 of the project. 6. Identify the vulnerable population that the problem affects. This will also determine who you will present to in part 2. 7. Write the nursing diagnosis. See template in Chapter 6 in NI's and McEwen textbook for more information. 8. Submit template through the Submit Assignment button on this page. Templates. Select and download from the links below the one that corresponds with selected topic. Air quality assessment and diagnosis template. Links to an external site. Substance use assessment and diagnosis template. Links to an external site. Best practices. Please use your browser's file setting to save or print this page. Use the template provided. If the template is not used, a deduction will be applied. See rubric below. Spell check for spelling and grammar errors prior to final submission. Use the rubric as a final check prior to submission to ensure all content is clearly addressed. Scholarly sources and citations. Since sources are on the template, citations are not needed. Week 2. Direct Care Project Part 1. Assessment and Diagnosis. Week 2. Direct Care Project Part 1. Assessment and Diagnosis. Thanks for watching.